Hello, good evening, and welcome to Become a Better Man. My name is Tunde Disu. Thank you for taking the time out to be part of today's program. This platform is called Become a Better Man. And as some of you will know or will have seen, for the past 15 days, I've been involved with a challenge called in raising awareness about PTSD. And when I started the challenge 15 days ago, I thought, what other ways can I add to this whole process? And so I thought, why not have some sessions during my normal weekly program where we can talk about mental health issues? So that's what led to the whole of this month being dedicated to mental health conversations. And every week we will have guests who will come on board to help us understand, to challenge us, to train us, to inform us, and enlighten us on what mental health is about, how to treat it, and all of that. But for today, we're going to have two wonderful people as our guests on the program today. I can't wait for both of them to come on board. If you've seen the banner that we put out, you will have noticed that we have these two guests coming on the program today. So it's going to be a great event. And I hope you are ready to learn. I hope you are ready to ride with us. And please, if you have questions, if you have questions, please, you can email them to the email address on the screen now so that we can take them and really just do as much as possible to do justice to those questions. So please feel free to send your questions in if you have any question. Excuse me. But before we bring on our guest, like I said, this all started with PTSD. What is PTSD? What is PTSD? PTSD stands for post-traumatic stress disorder. And you see, especially nowadays, when people hear about PTSD, the first thing that comes up in their minds is the veterans, the military, those who've been to war, and all of that. You're not incorrect, you're just incomplete, because PTSD affects other people, even civilians, even people who has never been to war are also affected by PTSD. So it's important for us to be aware of that. But the essence of today's program, like we said in the banner, is to talk about mental health. And particularly, we are going to be zeroing in on depression. We're going to be looking at depression, how it affects people, what it's all about, what is depression, how is it treated, what are the symptoms, what are the signs that maybe you are edging towards it, or to recognize somebody who is dealing with it, or things like that. We are going to be looking at depression on today's program. And we have two wonderful people who are going to join us to discuss this issue, to look at, okay, what is depression? And these two people that we're having on our program today, they are wonderful people. They are knowledgeable people. They are experts in their field. They've been doing this. They've been doing it on a practical day-to-day basis for over 15 or 20 years. So they come with a wealth of experience that they're going to be sharing with us today. So what's going on? Excuse me. So they're going to be sharing their experience with us on the program today. But before I bring them on, I just want us to know that there is no shame. There should be no shame. you shouldn't feel ashamed. You shouldn't feel ashamed for yourself or your friend or your colleague or your family who is dealing with this issue. I said in one of the postings on my Facebook, I said, mental health illness is real. Just because you can't see it, just because you don't understand it, does not take away from the fact that the people dealing with it, the people who are suffering, the people who are facing this challenge on a day-to-day basis, it's just as real to them as somebody with a broken arm, as somebody with a lung cancer or kidney failure. It is as real as that. I have one of the guests already on, ready to come on. And while we wait for the second one, I'll bring on our friend, our wonderful, wonderful friend, Rodney Chawota, who is ready to come on. Let me add Rodney to the broadcast. Ladies and gentlemen, this is Rodney. Hi, Rodney. Can you hear us?
Hello. Yes, I can hear you. Yes. Can you hear me?
Wonderful. Yes, I can hear you. Thank you very much. This is Rodney. I think we have feedback somewhere. Oops. There's something feeding back from somewhere. Just bear with me.
Okay.
Can you hear me now?
Yes, I can hear you. Yes.
Sorry, there's a slight delay because of the internet lag in between what I'm saying and what you're saying. So there'll be slight delay. But we have with us today Rodney. Rodney, can you please introduce yourself?
Okay. I think Nancy is just trying to log on. I'm not sure what issues she's facing at the moment. Yeah, but my name is Rodney. I've been working in mental health now for the past 18 years. I've got vast experience with various care groups, various different service users from various backgrounds, and with various mental health problems. So I'm very well experienced in mental health, and I've got a lot of experience behind me in dealing with people from that sector of society.
Excellent. So, like how many years of experience would you say? Where is the
Yeah.
feedback?
So I've been in mental health now for the past 18 years. So 18 years is how long I have been doing mental health.
Excellent. So, we are going to talk about depression.
Yes.
I was tempted to try and say something, but I thought, don't muddle the water. Let the experts talk about it when they come about. So, Rodney, while we're waiting for Nancy, can you tell us what is depression?
Okay, the tricky part here is that Nancy was supposed to give an elaborate explanation of what depression is from a in-depth perspective. But basically, depression is a mood disorder that manifests in extreme low mood that lasts for beyond 2 weeks. So someone who's experiencing an extreme low mood for a period of more than 2 weeks is classified as having depression. So in essence, that is what depression is as a simple term. That's what depression is.
Thank you for that, Rodney. I was trying to get Nancy on, and we have Nancy now. So I'm going to add Nancy to the broadcast, and she can introduce herself and tell us a little bit about depression. So, Nancy, are you ready?
Yes.
Wait a minute, I can't censor myself, guys.
Take your time. So, you were saying Rodney. Now you were saying that depression is something to do with how you feel.
Yes.
Am I correct? Yes. Good. So, is that something you choose? Is that something you choose or something?
So depression is caused by a variety of things. This could be what we call psychosocial symptoms, psychosocial issues. So things like your background, your upbringing, personal experiences, and things of that nature. That's some of the things that can cause depression. So depression can also be a biological, can also have a biological element where the chemical in your brain that's called serotonin, which is basically the what they call uh, uh, the happy hormone. So once levels of that serotonin reduce in your brain, that can cause you to have depression. So depression is not something that someone chooses. It's something that happens to you due to a variety of reasons. So there's a variety of reasons that causes someone to have depression. So like I said, it could be your personal experiences, traumatic experiences. In some cases, some people have been, in cases of people who have been bereaved, for example, you've lost a loved one, you can have depression because of that. In cases of people who have been abused, some people have been sexually abused, they've been physically abused, that can cause you to have depression. Sometimes even people who are sick, you know, if you've got a terminal illness, for example, people who've got things like cancer, you know, terminal diseases, even people who have poor mobility because of diabetes and things of that nature, they can also develop depression. And some of the other things that cause depression in people is things like substance misuse. So people who use drugs, cannabis, cocaine, things of that nature, those things can cause someone to have depression because they tamper with your mood, basically. As well as alcohol, like people who drink alcohol in excess, they can also end up having depression. Alcohol in itself is actually classed as a depressant. It specifically causes people to develop depression over long periods of time. So you see, it's a variety of things that cause someone to have depression.
Excellent. Let's bring Nancy on now. I think she's ready for us. Hello, Nancy.
Hello, good evening, Mr. Disco.
We can't see you yet.
Yes. Yes, that's it. There she is.
Oh, that's better. That's better. Here is Nancy. So, Nancy, can you please introduce yourself to us?
Good evening, everybody. Thank you for joining us tonight. My name is Nancy Mapunde, and I have 15 years experience working within the NHS, supporting people experiencing mental health illnesses. And it's something that I'm quite passionate about, and it's something that I really enjoy because in this journey of their illness, it's important to have individuals that care and support them to make things easy for them. And that's me.
Well, she said that's her. I think there's more to you than that. But thank you, Nancy, again for being part of today's program. Rodney has been telling us about what depression is, but he did say that you are the expert. So, in your own way, can you tell us what is depression in light of mental health issues?
It's important to highlight that depression, a real illness with real symptoms, and it's quite common, and it affects anyone at any point in life. It doesn't matter your background, it doesn't matter who you are, it doesn't matter what you do or what you have. And it's important that when a person who's experiencing depression, they've got the right support network around them. Also, those people who are experiencing depression, it's important to realize that it's not something that you can just snap out of by putting yourself together. And people that are supporting them shouldn't be telling them things like, oh, just get over it. Oh, just you'll be okay. It's not as simple as that. It's also important to understand that it's not a weakness. And if you are experiencing mental depression, it doesn't mean that you're a bad person. As Rodney was saying, that there's a variety.
Go ahead. I just wanted to bring Rodney back into the fold.
As Rodney was saying, there's a variety of things that does cause depression. Depending on what symptoms you present will determine the type of depression that you have. Usually it's classified as mild depression, moderate depression, and severe depression. And with severe depression, a person can present with psychotic symptoms, whereby this person might see things that other people might not see, or hear things that other people might not hear. They might also they might believe things that are not really in touch with reality. For an example, they might believe that they're related to the Queen of England, or they've got special powers that can make them fly. There's also depression that can be experienced prenatally or postnatally, whereby the prenatal depression, you experience it while you're pregnant, and postnatal after you've had your baby, and that usually happens within the first year. What a lot of people might not be aware of is that men can also experience postnatal depression, because that's a major life change in someone's life. So they might not be sleeping well, they might not be concentrating well.
Did you say men can also
and as a
experience?
Yes, they can experience postnatal depression, because that's a major change in the family. There's a newborn child within the family, and routine within that environment will have to change. And for some men, if it's their first time welcoming a child into the home, it's a massive change. So they might not know how to deal with these changes. And as a result, they might feel, oh, I'm not helping my wife enough. And they start feeling guilty. They might not be sleeping very well. So that could lead to depression.
Rodney, I'll need you to chip in here. Nancy just telling us about various types of depression, and I'm surprised that men can have postnatal depression. I've never heard that before, but hey, we're here, we're learning.
Yes. So men can experience postnatal depression as well, because let's not forget that depression basically is caused by stress. So like any other mental health condition, stress is the key factor here. So whenever you experience any level of undue or increased stress, there is a chance you could develop a mental health condition. And one of the mental health conditions you can develop due to increased stress is definitely depression. So the unexpected the newborn that's now in the family, the fact that you're now not sleeping as you used to, you now have to be, up all times of the day and night. The fact that you perhaps have other children to take care of. I mean, from my own personal experience as well, I know that's something that can happen. Not saying that I had depression when I had my children, but it's something that can definitely happen because you're under a lot of stress and you're under a lot of pressure. And when you're under a lot of stress and pressure, it definitely affects your mental health. So in some men, when they have newborn babies, it's known to suffer a great deal of stress, which can lead to depression. So definitely it is very possible for men to have postnatal depression.
Excellent. So we've talked about what depression is, and we've talked about the types or the variances of depression. We all live in communities, either in a small family, in a large family, in a village, or on a street. What are some of the symptoms? What are some of the signs that you will notice in people, or you will see in somebody, for you to know this? I think this person is dealing with depression. I mean, I'm not saying you go about with magnifying glass looking for who is misbehaving and all of that, but at the same time, what do you need to see to recognize depression? Nancy, if you can tell us, please.
Yes,
Nancy,
I
I think
can definitely take that on. Some people can tell you that they feel low within their mood, and as a result of this lowness, they might tell you that I lack energy to do things. They are having difficulties getting out of bed. They're not dressing as sharply as how they normally dress as sharply. They might say, oh, my life is not worth living. They might start saying that they feel like they want to hurt themselves. They might start talking about they're ending their life. They'll start saying that they want to kill themselves. You can also notice that maybe they're not eating as much as how they would eat, or they are not sleeping. They are awake at night time, or they might stop engaging in things that they normally like to do. They might stop attending family functions. They might stop hanging out with their friends. And those are some of the signs that you can pick up. Some of them, they might be tearful, just crying for no reason, or they might be feeling sad.
Right, Rodney, can you add to that for us, please? Some of the signs, the symptoms, the samples of what somebody will look like, or be what we can see in people if they're going through depression.
Yeah, so basically, what Nancy has mentioned are basically the core symptoms of what someone will experience when they have depression. So there's also things like someone when they're depressed, they become withdrawn. So they're not engaging with people like they used to. They are keeping much to themselves now. Perhaps they were an outgoing person. They used to go out all the time, but now they're not going out anymore. They're always at home. They don't feel confident enough to engage with people anymore. Lack of sleep. They're not sleeping as well as they used to. Their appetite is low. They got low appetite. They're not eating properly. And these are typically the core symptoms of when someone has got depression. And as well as Nancy mentioned, they feel a worthlessness, you know, they feel like they're not worth anything, and they feel like life is not worth living, you know, they feel like there's no purpose to life, like, and in cases they will actually wish that they were dead, you know, they will have suicidal thoughts, they will be thinking of ways to kill themselves, ways of harming themselves, um, and things of that nature. So basically, these are the sort of core symptoms that one would expect to see if someone has got depression.
There's something I picked up from both of you when you're talking. You both mentioned something to do with eating pattern, because usually when you hear somebody they have eating disorder like bulimia or I don't know what the other one is called. Generally, maybe I'm speaking as a novice here, but generally you don't attach that, you don't see that as a form of depression. It's like, oh, that person is got eating disorder. So are you saying in effect that eating disorder could be a sign of somebody dealing with depression? Nancy?
Someone with eating disorders, with depression, it can coexist with eating disorders because this person is feeling a certain way about food. So they might be feeling, if I don't eat a certain amount of food, I will look a certain way. And if they don't look that certain way, or if they don't reach a desired weight goal, they might start feeling low in their mood because they feel they failed to reach that target that they want to. So as a result of that, if they keep feeling like that for more than 2 weeks, then yes, that can lead to depression.
So somebody who, but then sometimes from what I have seen, of what I've heard, most people with eating, let me bring Rodney back here. Most people that have
Yeah.
eating disorder, they don't even know that, okay, somebody is saying, I look fat, when everybody can see that you've actually a skeleton walking. So the fact that they don't have the reality of their existing position. Try and help me here, because I'm trying to see how that relates to depression. But
Yeah, so basically, I think the way that when you talk about eating disorders, there's two main eating disorders. There's bulimia and anorexia. So anorexia is where someone actually starves themselves because they want to lose weight, and they want to go down to a certain targeted weight, which is usually a very unhealthy weight. So for someone to deprive themselves of basic food, uh, uh, um, it's a psychological element where you want to attain a certain goal. But with that as well, some people with anorexia will experience a mood component to that, where they also have depression on top of their anorexia. So the anorexia, it can coexist, as Nancy said, with depression. But the main issue is that they are depriving themselves because they want to lose weight and they want to achieve a certain weight. But anorexia can also cause them to have depression, or depression can cause them to have anorexia. So that's one side of it. And then bulimia is where you eating to excess. And in some people who eat to excess with bulimia, they are eating to fill a void. So there's a certain emptiness that they feel inside. So they eat too much to fill that void, that emotional void that they're feeling. you could interpret that emotional void that they're feeling as a type of depression. You can interpret that as them experiencing some element of depression that is causing them to eat in excess. So eating disorders, in as much as they are eating disorders per se, they can also coexist with depression. And also one key element about eating and diet in relation to depression is that eating an imbalanced diet has been directly linked to depression. So there's actually several research that has been done out there to look at the relationship between a good dietary intake and depression. And they've actually found that having an imbalanced diet can cause someone to have depression. So that is why it is vital for anyone to have a balanced diet, so that you maintain that stability in your dietary intake, and you possibly reduce the chances of getting depression. So yeah, food and diet very important when it comes to depression.
That's excellent. So, would you then say, and Nancy, I'm asking this question to you, posing this question to you, is it then okay, or is it a good assumption to think depression as a result of imbalanced diet can be particular or can be prominent in a particular demographic group of people, or is it everywhere? I'm saying if imbalanced diet is an issue, for instance, would you say that is something then that one needs to be more aware of, especially among our type of people than the Caucasians?
Well, unfortunately, I am not sort of qualified to give specifics about the scientific aspects of the specifics of how the diet will scientifically link to depression, and how it may affect different demographics from that perspective. I think that will be something for someone with more specific experience in that field to answer. But basically, from the knowledge that's out there, the basic knowledge that's out there, definitely your dietary intake and your having a balanced diet does help you prevent the possibility of getting depression. So balanced diet is always recommended when it comes to depression.
Excellent. So let's therefore, we've talked about what depression is. We've talked about some of the causes of depression. We've also just been speaking about some of the symptoms or signs that you will see. Then it begs the question, is there any standard specific treatment that can be applied to depression? Nancy?
Can you please repeat the question again, Mr. Disu?
Now, I was saying, we've looked at what depression is. We've talked about some of the causes, some of the symptoms. So I'm now asking about the treatment side of depression. Is this something that can be treated with medication or with therapy, counseling? Is there anything that can be used to treat depression?
Yes, depression is very treatable, and there's various treatment options that are available out there. And we usually encourage those that are experiencing depression to, first of all, speak to someone that they trust about how they are feeling. And if they feel that they don't have a person that they can talk to, they can approach their GP, they can approach maybe their people from their faith communities to talk about how they are feeling. And from the GP, he can then now recommend options. There's talking therapy that you can engage in, whereby you'll be taught different techniques and skills of how you can cope with some of your symptoms. And if medication is needed, the GP can look at can recommend some medications to yourself. Some people can meditate. Some people can practice mindfulness. Some people might resort to health and fitness routines and regimes that can help to prevent depression. And I think I'm going to have to hand over to Rodney, because he will be able to give you the specifics in terms of like the kind of talking therapies that are out there, but it definitely can be treated.
Rodney, did you see what she just done there?
So
pass the question now straight.
No, it's just that I think I had done more research into this side of things, so I've got more sort of specific information about treatment and strategies. So basically, like she said, you've got to look for someone you can talk to. So you need to find someone that you can trust, someone who you know you can open up to and talk about how you're feeling. And it's important for anyone who is supporting someone who's opened up to them about depression. So someone opens up to you that they're feeling depressed. You need to try and create a space where you can talk freely, right? So that's the first important thing. You need to try and create a space where you can talk freely, right? And it's also very good to be quite attentive when someone is telling you about how they're feeling. So you need to listen to them carefully, listen to them what they're saying, and try and be what we call empathetic. So try and put yourself in their shoes to try and sort of empathize with how they're feeling. Okay, so that's the first important thing. So someone who's experiencing depression would need to find someone that they can talk to. So if you don't have anyone that you can talk to in the immediate vicinity, there's various services that you can phone. So you got things like the Samaritans, for instance. That's a charity that's available 24 hours a day. There's always someone that you can speak to on the other end of the line. And the Samaritans are quite helpful. I think a lot of people have had a lot of support from them and found their service quite useful. So after Samaritans, if your symptoms are perhaps more severe and perhaps talking to the Samaritans hasn't helped you, right? You can always ring 111, which is the NHS service. 24 hours a day, there's always a practitioner you can speak to on the other end of the line, and you can tell them about what you're experiencing, the symptoms you're experiencing, and they'll be able to give you support and tell you what you would need to do next. All right. And if perhaps talking to 111, they suggest that you go and see your GP. So you can always go and see your GP, book an appointment to see your GP. Your GP will do an assessment. They will determine how severe your symptoms are and what treatment option that they think that you feel. In some cases, some GPs will only refer you for psychological therapy. So they'll refer you for things like counseling or mindfulness, which can be provided by the various primary care providers who provide those services of counseling and mindfulness as well is also one type of psychological therapy there is. There's also interpersonal therapy as well, which looks at how you interact with other people. And there's also something called CBT, cognitive behavioral therapy, which looks at your thought processes around how you think about things and how you process information, which is quite helpful for people who've got mild depression. So another thing that the GP could also do, they could also prescribe you medication. You may have heard or may have come across what they call the SSRIs. The SSRIs, they are serotonin uh, reuptake, selective serotonin reuptake inhibitors. It's a bit of a mouthful, but basically what that does, they are antidepressants that work on increasing the serotonin levels, that hormone that I mentioned earlier on, the happy hormone. So they work on increasing that serotonin, which will help boost and improve your mood. So in a lot of cases with people who have got severe depression, they will have combined treatment where they have counseling and where they have psychological input as well as antidepressants, as well as medical input as well. And in a lot of cases, a lot of people with severe depression benefit quite a lot from combined therapies. And then as well, on the extreme side of things, we have what we've called ECT, electroconvulsive therapy, where they can place electrodes on your head to try and help stimulate the hormones in your brain so that your mood perhaps can improve. But that is in extreme cases. And in these extreme cases, these are usually people who are non-responsive at all, people who are in a state that we call catatonic, where they're not able to respond to anything. They're totally sort of detached from reality. So in such extreme cases, you can have what is called CBT. So the efficacy of these treatments is quite good in most cases, and a lot of people will experience quite good recovery from these treatments. But it's also very important that anyone who is prescribed these treatments, be it the medication or the therapy, you stick to it. And because in some cases, some people think, oh, I've taken it for 2 weeks now. I think I'm feeling better. I don't have to take it anymore. So we always advise people that if you're going to start on a course of antidepressants, for example, you always need to make sure that you consult your GP first before you start taking the medication. So that is very, very important.
Excellent. I have a question here. The question is, what is the difference between depression and anxiety?
I think Nancy can take that one.
Okay, let's bring Nancy back. Payback time. I like this. So Nancy, so what
We've
is the
already heard
difference
some
between
of,
depression and anxiety?
well, anxiety is a feeling whereby a person is very worryful or very fearful. And as a result of that, they start to experience being sweaty. They start to experience shortness of breath. They start feeling sweaty, their heart is racing, and they're a bit shaky in certain situations. So the difference is, I think, is in the symptoms. And with anxiety, as a result of this worry and fear, if it carries on, you might end up worrying to the point whereby you're not sleeping well, thinking of whatever it is that you're worried about. You might also end up not eating properly as a result of this worry and fear, and that leads or can lead to depression. And
Wow.
there you have the differences between those two. I'm not going to go too much into it because somebody's going to be talking
Yeah,
a bit more in depth.
yeah, I appreciate that because
The symptoms.
we're going to have different guests on the program throughout the month, and one of the topics we'll be looking at is anxiety. We'll be looking at stress. We'll be looking at suicide. We'll be looking at PTSD itself. So I appreciate what you said. Now, there's another question here, which is a follow-up to what we've been discussing. And the question is, how can friends and family help people that are dealing with depression? How can we help them? I'll take
Yeah,
myself out.
so like I was mentioning earlier on, so it is very important to be attentive and listen to them when they are talking. So a lot of the times when people are talking, particularly I'll talk about men for a bit. So basically, from a man's perspective, it could be, I think, if I can say an African man or a black man in general, we've got this persona that we carry around with us, where we are supposed to be very strong, very organized, and very focused. And we want to give this impression that we've got everything under control. And a lot of the times, some of us, we are really suffering deep inside, but we don't have the courage to speak up, because as a man, you're supposed to be strong. As a man, you're supposed to have things under control. But that is not always the case. You're not always able, you're not always going to be on top of the game. And it's important that people around us as men, they understand us, that, this is another human being. They can also experience stress the same way that a woman can experience stress. A man can also experience stress. So it's very important for society in general, even other men, looking at other men and say, I understand that you can feel the way that you're feeling. But in some cases, I know a lot of people would want to sort of say, oh, get over it, man up, I think is the popular phrase when people talk to men. It's like, man up. That's not how a man should be. But the reality is, men also suffer emotional issues. They also suffer from depression. They also find it difficult to cope a lot of the times. But society always expects us that we are always going to have this brave face all the time, which is very unrealistic. So I think the first thing that family and friends can do is to acknowledge that this person, what they are experiencing, for them is real, right? For me, I may not understand how they are feeling, but for them, that experience that they're having is a real experience, and that is what we call empathy in healthcare, where you empathize with the person and say, okay, I may not understand fully how you're feeling, but I can understand that the way you're feeling right now for you is real, and the emotional pain that you're feeling is real. So we need to validate their experience. We need to validate the way that they're feeling. It's very, very
Okay.
important.
All right. Nancy,
Yeah.
Rodney has spoken about, at least to some degree, the issue of depression with men and how they can be supported. From the women's side, what's your take?
Women, we like to talk a lot about how we feel, and we tend to be very open, and and I think we tend to get our support from our girlfriends or from our families by just talking out, or we go out for a cup of tea, we hang out, we go shopping, we support each other in that way. So I think as women, it's important to also listen when your friend is talking, because sometimes some people might not tell you exactly that they are depressed, but it's important that you're attentive and really, listen to key words that they might say that might make you think something is off here. And I think that just hanging out and talking and having that regular contact and reaching out to people on a regular basis, just finding out, are they okay, and taking a general interest in the day to day of that person's life. Because if you're asked, how was your day to day? How are you getting on in a particular thing that person likes to do or to enjoy? It makes the difference, because that person will most likely open up and talk to you because you're showing an interest, you're showing that you care. So take interest in knowing, what makes people happy, and support people in those things that they enjoy doing by asking them how they're getting on, and just reach out to people.
All right. I want to bring Rodney back just before as we start to round up, because I want us to look at it. Thank God, the two of you and the three of us are parents. I have three adult children, and sometimes as a parent, there's a level of expectation and the way you've trained and the way you've raised your children. How can parents, how can we help our children, irrespective of their age, understand what they are going through, what they are dealing with? Because some of them, they go to school and they are being bullied, or there's a lot of pressure because of the educational expectations and all of that. And some of that can lead to depression. But as parents, how do we recognize that? How can we help our children? Rodney.
Yeah, so I think it's very important to be at when they're talking to us, and I think particularly in this era that we live in, the COVID-19 era, where the world has changed in so many ways, it's important for us to be a lot more attentive now than we've ever been before, because they are very isolated now. There have been cases, unfortunately, of young people in some parts of the world who have killed themselves during this period because of the psychological and emotional trauma that they are feeling during this time, where they're isolated from friends, they're isolated from school, they don't have any activities to do, they are bored at home, they feel isolated, they can't do anything. So it is a lot more important now than it's ever been for us as parents to take a closer look at our children, pay more attention to them now, because that support network that they had before, the school, friends, and all these other things, it's gone at the moment. It's not there. So we actually have to be a lot more attentive to them now. See if there's ways we can structure the days, have set activities that we can do with them, structure their days if there is learning that we can do on the computer, if there's activities that we can do at home, just to keep them busy, basically. Because they say that an idle mind is the devil's workshop. So an idle mind, a mind that's not engaged, a mind that is not active, there's a chance that a lot of things could be going on in there. There's all sorts of negative thoughts that can come up. There's, all sorts of negative aspects that can come when one's mind is not engaged. So it's important for us to try and keep this, trying to fill up their days with things to do, try and engage them in things that we can try and do at home. It's about us as parents being creative. We have to try and be creative and adaptable to the current situation, which is always a challenge. Which is a challenge at the moment, but there's lots of development. There's lots of new things coming up each and every day. There's lots of new ways, new techniques being found every day to try and keep people moving in this sort of stagnant world that we're living in at the moment. You see now things are being done online on computers. People are talking now. We're having this discussion. We're having it online. The day probably would sit down and have a chat, but now we're having to talk over the internet. So, and I think the world is slowly grasping that reality and kind of finding new ways and new techniques to try and catch up, basically. But I think the key thing is for us to be attentive. We have to listen to them. When they are there to us, we have to be mindful what they're saying to us and how we can try and support them. But the first and foremost thing is to be attentive. We need to be more attentive.
Thank you. Nancy, you add to that, please?
I think as parents, it's important that we're not quick to be reactive. It's important that we just let them speak, allow them to vent out everything that they've got to say, and we don't judge them for feeling the way that they're feeling. Let them know that it's okay to feel the way you're feeling. It's okay to go through whatever it is that you're going through, but I'm here as your mom or as your dad to support you through whatever it is that they might be experiencing. But don't be quick to be reacting, saying, oh, some parents will be like, oh, you're only just a child. What problems do you have? What do you know? Some parents are very reactive when their children are sharing things. So it's really, really, really important that you're very slow to react and listen to your child. Go out into your local area, go for walks, try new things while you're at home, try baking, cooking, try out new recipes, listen to music, read with your children, play games, do quizzes. Just try to be active during this time at home with your children.
Excellent. Let me add Rodney to the party. Uh, it's amazing how quickly 1 hour can fly by. Hmm? Um,
Yes,
Nancy,
indeed.
Rodney, and to all our viewers and friends out there, I have learned a lot today. I've learned a lot as a person, as a husband, as a father, as a member of a larger community, because mental health issue is something that we don't really know a lot about, especially amongst our kind of people, among the blacks, especially if you are from my part of Africa, or West Africa. When people hear the word mental health, all they can remember is that crazy man in the village that goes about naked, picking up just particles on the road and chasing everybody down. And so we come with that mindset that that's what mental health is.
Mm-hmm.
But hearing what you experts are saying tonight, and from what I have been reading and I've been exposed to, I there's more to read than what we thought. And so we need to be educated, we need to learn more, we need to continue to find ways of upping our game, of increasing our knowledge. Because unless we are knowledgeable, we won't be able to help the people around us. And we won't be able to help ourselves when this thing comes knocking on our doors, because it can visit anybody at any time. So we will continue to dig this well. Don't change your phone numbers yet. I may have to bring you guys back before the end of this month, because this definitely has been very enlightening, very educative, very informative. And I want to thank both of you on behalf of everybody for taking time to share this knowledge with us, to help us understand that this thing doesn't visit people by postcode. It just picks on whoever and it stays with them until they can get help. So
Mm-hmm.
again, thank you guys for your time. Thank you for coming. If I get any more questions after the broadcast, I'll be knocking on your door myself to say, help me out. Thank you.
That's
God
fine.
bless you. We will continue on this platform. We will continue on this platform next week as we look at another aspect of mental health issue. We're still going to look at the issue of stress, anxiety. We're going to look at suicide and all of that, because let's face it, these things are real. But more so, we are going to, before the end of this month, we're going to have a guest on the platform who is going to look at COVID-19 and all the lockdown and everything, how the whole world system, how they've changed, and the effect of that, if any, on our mental health, on our stress level, on our temperament, on everything to do with us, and to see if there are connections between what the whole world has just experienced or still experiencing, and how that can possibly lead to mental health issues. So we're going to be digging this well for the next 4 weeks. Again, I want to thank Nancy. I want to thank Rodney for taking the time out to be part of tonight's program. If you have questions, please feel free to send in your questions. My email address is on, where is it? There. That's my email address. Please feel free to send me your questions. I will chase these guys down. I'll make sure they give us an answer, and I will send them to you or talk about it in one of our programs. So please don't think because the program is over, then that's it. That's the end. No, you can still ask those questions, and we will do our best to answer them. On behalf of everybody, this is what it means to become a better man and a better woman. Increase your knowledge, deepen your understanding, enlighten yourself, grow yourself intellectually, get more information. And as we all do that, everybody around us will have no choice but to say, definitely, these are better men and better women. And I'll see you again next week. Bye bye. Have a great week. Thank you.